Hi everybody, I'm Nurin. I'm a dental graduate currently waiting for my posting, and this is Lepas Sekolah.
Nurin, when you were younger, what did you want to be?
Growing up, actually I wanted to become an engineer the most, mainly because my interests as a high school girl gravitated the most towards the area of physics, maths and maths. So yeah.
Nurin, which secondary school did you attend?
I went to Sekolah Menengah Kebangsaan Infant Jesus Convent Johor Bahru.
Some students choose to head to boarding school for their secondary school life. Was that ever a consideration for you?
It's never really a consideration for me. My family and I, we are a bit overly attached to each other, so I am quite clingy actually, and I get homesick very easily. So I never really wanted to be away from home.
What stream did you choose to do for SPM?
I chose to be in the science stream because I wanted the flexibility that it would promise me in the future at that point of my life.
What was the most challenging aspect of your secondary school life?
I think probably trying to get like a decent co-curricular marks actually. When SPM was approaching, I was told by so many people that it's also important to actually focus on your extra co-curricular activities. I feel like if I could turn back time, I would just loosen up a bit and like focus a bit more on becoming an all-rounder instead of just paying 100% attention on my studies alone. Yeah,
And Nurin, how did you do for SPM?
I did okay, I guess.
Nurin, were you offered any scholarships after SPM?
Yes, I was offered a scholarship by JPA Mara to pursue a twinning program between College Yayasan Science Malacca and New Zealand. And I had the choice to choose either any of the four programs that they offered me, which was for actuarial science or accounting, finance or economics.
Did you take up the scholarship?
No, I turned down the scholarship for my UPU offer instead.
Why did you choose to turn down the scholarship and what did you choose to do instead?
I think my main drive at that point was because I really badly wanted to fulfill my dad's request actually, and also because what I was most interested in was for actuarial sciences. I really like maths, but I also really like sciences as well, and not human sciences. So once you pursue actuary, I was told also that you need to study a lot of human sciences, and I just wasn't sure if I was gonna like that area specifically. I chose to do my foundation in biological sciences at UITM Dengkil.
Looking back, do you have any regrets turning down the scholarship?
I think when I was facing like hard times while completing my degree, as a human being, I obviously there were moments where I felt like, oh, if only I had chosen the other offer, maybe it would have been an easier journey for me. But that was then lah, you know. But in the present, I feel like I've never really looked back and regret my decision.
Nurin, what advice do you have for students who are currently facing major dilemma in their education journey?
My advice would be try to have like a long-term plan visualized, because when you're picking something that you want to study, when you're picking a degree, it's actually, to me, it's a lot more about whether or not you're going to practice it in the future as a profession for a lifetime. And it's not entirely about making sure that you're going to be able to graduate with the highest GPA. You're not going to practice it as a profession. Is it still a degree that's worth taking anyway? I feel like those questions should be able to help you. But I do understand, you know, for a 17-year-old kid, it would be a really tough thing to do, to have it all figured out, to really decide what you want to do for a lifetime, right? So if that's the case for you, I feel like the best thing to do is to just pick the safest option. And when I say safest, I mean it in the context where pick something that you think would promise you a better flexibility in the future in terms of what you can do and what you cannot do.
Earlier, you mentioned that you did a foundation in biomedical sciences. Can you tell us where and can you tell us why did you choose to do the foundation instead of any other pre-university course?
I did my foundation in biological sciences at UITM Dengkil, and I chose foundation as my pre-university program because it was the shortest pathway for me to get pre-U over and done with. I preferred the flexibility that it would promise me in the future, so that I could have like plan B and plan C just in case if I don't get into dental school.
How is it settling into UITM Dengkil and being so far away from home?
Actually, it was a lot better than what I expected. As I was mentioning, I am the kind of girl who gets homesick very easily, but while I was trying to settle into UITM Dengkil, I feel like it was a very bearable experience for me. And I think I've got to thank the people that were there for me at that point of my life. I had some of the best housemates, you know, to accompany me, and my lecturers were all very supportive as well, so that helped me a lot as well.
Nurin, what was your aim going into the foundation course?
because I really wanted to get into dental school, right? So my aim was to make sure that I secure a 4.0 CGPA actually. That was my main goal. I was desperate for that, and of course I just wanted to enjoy my university life for the first time ever lah.
What was your fondest memory of UITM Dengkil?
Meeting some of the best people there is my fondest memory. I met some really fun people there actually, and yeah, it was a really great memory for me.
Nurin, after your foundation in biomedical sciences at UITM Dengkil, you did a bachelor in dental surgery at UKM. What was the application process like?
So I applied for the program through the UPU system. So I just had to apply on the UPU, and I put UKM dentistry as my first choice actually. And then once they get it from the system, and UKM will actually call you to screen. During my time, I was required to submit a video submission as the screening process. Can't exactly recall actually what was the content of the video, probably just some rough introduction of myself and why I chose dentistry. And after the screening, they will then choose who will they interview. So after the screening, there will be a one-to-one interview session. And during the interview, there's also a hand skill test where for me, during my time, I was required to carve a tooth out of a soap.
Nurin, do you happen to recall what the entry requirement is for your course at UKM?
For me, since I possess a foundation in biological sciences, they required a minimum CGPA of 3.5 at least, and also a band 3 MUET, and you also have to excel the interview as well.
Nurin, of all the degrees out there, why dental surgery?
Honestly, because first of all, my dad actually asked me to consider medicine, but I had to say no to that because I just didn't think that the idea of practicing medicine for a lifetime would suit the lifestyle that I wanted in the future at that point of my life. So I still wanted to really badly fulfill his request. So what I did was that I negotiated from there. I was asking him if dentistry was a better call in my case, and he did agree with me. And apart from that, actually, although I mentioned that I really like sciences, I also really enjoyed arts as a kid. So as cliche as it sounds, actually dentistry is really the perfect fusion between these two fields.
Nurin, what is the structure of your course at UKM?
So my course was 5 years long. The first 2 years are your preclinical years, and then the remaining 3 years are your clinical years. In your preclinical years, you will learn basically basic medical sciences, subjects like human anatomy, physiology, biochemistry, pharmacology, pathology, things like that. And in your second year, during your preclinical year, you are also allowed to perform clinical procedures, but on dummy heads in a simulation clinic. Then only after you complete all the requirements that they need, then only you will be eligible to sit for the following year, which is your first clinical year, which is your third year. Yeah, and then in your clinical years, starting from the third year, you will have to perform clinical procedures on actual human beings, on real life patients in a clinical setting under supervision by your clinical lecturers. And you obviously don't do all of that for fun. You have requirements to fulfill as well. The course is designed in a way where even if you fail one of the many subjects that you take in that current academic year, you are not eligible to sit for the following academic year, meaning you have to repeat everything all over again. Even subjects that you have to subjects that you have passed, you still have to attend all the lectures and whatnot. Yeah.
What is a common misconception about dental students?
One that I can think of is the fact that dental students only learn about teeth and only. Because if that's the case, honestly, it wouldn't be 5 years long. We learn more than just about teeth. I remember one time when I was actually attending an online lecture, and my dad was passing by behind me, and he saw like a picture of our lower limbs, our legs, and he was asking me, kenapa belajar pasal kaki? Ada gigi ke kat situ? So it's a very common misconception about dental students.
And Nurin, what would you say is the most difficult aspect of a bachelor degree in dental surgery?
To me, it's got to be trying to complete your clinical requirements, because unfortunately, when you are performing a clinical procedure on a real life patient, right, it's not the same like trying to sit for an exam. If you are trying to sit for an exam, as long as you study hard enough, as long as you prepare yourself really well for the exam, most of the time you will be able to at least pass the exam. But when you are performing a clinical procedure in a clinical setting, regardless of how much you prepare yourself the night before, just some things might go wrong. Yeah, you just never know what could go wrong actually, and the extent of uncertainties that could happen is almost like endless to me. One example of something that happened to some of my friends actually when I was trying to complete my degree was that when they were at their last stage of issuing a denture or issuing a bridge, which is their requirement, right? On a case that they have worked on for some like 3 or 4 semesters, and then they call the patient the morning before the appointment, only to find out that the patient has died actually just the morning before the issue appointment, which is a very unfortunate thing to happen to both the family of the patient as well as the clinician, because once something like that happens, by hook or by crook, you still have to complete your requirement, or else you will be barred from sitting for your exams. Having said that, when something like that happens, you just have to find a fresh new case, in order for you to start everything from scratch again. And I feel like this is where your survival skills are really tested.
Nurin, do you have a favorite module?
I think my favorite subject is probably oral maxillofacial surgery and prosthodontics.
Nurin, walk us through a day. How do you prepare for your classes and how do you do well?
Honestly, I'm not the best person to ask for tips from, but I would say maybe just if you're sitting for an exam, then prepare early. Don't be last minute, because when you're doing dentistry, there's just a lot of theories that you have to pick up, a lot of memorizing that is required as well. So to me, I think it's better to prepare early and don't be last minute.
Aside from your academics, were you involved in anything else in your university life?
Honestly, not so much. Again, if I could turn back time, I would probably, loosen up a bit and focus a bit more on becoming an all-rounder instead of just focusing 100% on my studies. Yeah.
Nurin, as part of your Bachelor of Dental Surgery, you must fulfill your clinical requirements which involve hospital-based training. Do you mind expanding on this?
Actually, most of our clinical requirements, we perform most of them in clinical settings, which means we did it in the clinics at our faculty, in our campus. However, there are certain modules of certain subjects that required us to actually go and perform treatments in a hospital-based setting. So, for example, modules from oral maxillofacial surgery or pediatric dentistry, where we were required to perform treatments on special needs patients in the pediatric department. And then in oral maxillofacial surgery as well, we also had to observe surgical procedures performed in the operation theatre, and then we also had to get the exposure of attending a patient in the emergency department in hospital. So that was kind of like the extent of exposure that we got from hospital-based training.
Nurin, what is the culture like at hospitals when you do your hospital-based training?
The culture was okay. I mean, I feel like the medical officers, the medical staff, and also the nurses, the specialists there were all very welcoming and very warm towards us dental students when we were attaching at hospitals. And also they were really great at their job. But one thing for sure is that I think you have to prepare yourself really well before you actually go to a hospital, because most of the things that they do there is like urgent, right? I mean, they work at a faster pace compared to how people work in the clinics, when comparing hospital versus clinic. So because of that, I feel like our job as dental students is to respect them because they have so many things to do.
Nurin, what are your best and possibly your worst memories during your clinical years?
My best memories have got to be when I met actually some of the nicest people as my patients. Alhamdulillah, I think I am very grateful that most of my patients really understood that I was a student, and it was probably one of my first few times, performing that clinical procedure. So they would really just encourage me to finish my clinical procedure no matter how long it takes, no matter how long they had to wait actually in the clinic. They were very patient and just very understanding, and even up until today I still keep in touch with some of my patients. They are such great people who helped me a lot actually. Yeah, so that's probably my best memory in while I was trying to complete my requirements. My bad memories, maybe my worst memory has got to be when every time I fail to perform a procedure lah, or whenever I fail a competency test, it's not a good memory, to be retained in my brain, because sometimes, you can't really control your emotions. Sometimes you cry, regardless of if it's in front of your patient or not. So it's not really a good memory for me, but very, but regardless, I think it has taught me really meaningful lessons anyway. So
Nurin, you'll be doing your compulsory service soon. Can you please tell us what it is?
So a compulsory service is a mandatory service that you have to carry out. Actually, all fresh dental graduates have to perform their compulsory service for at least a year before they are eligible to maybe open up their own practice or go for private sector. And you actually have the choice to either serve the government, the armed forces, or some public universities actually, in order for you to complete your compulsory service.
Nurin, do you get paid during your year of compulsory service, and if so, how much?
Yes, we get paid. I think right now, if you work for the government, you get paid a net salary of 5,000 ringgit. But I'm not too sure about the other sectors.
Nurin, are you planning to specialize in any part of the dentistry industry?
I have the dreams actually to further my studies, but in terms of what specific specialty that I want to pursue, I feel like I need to grasp the working experience first, in order for me to really decide what specialty I want to pursue. Because dentistry is a lot of hands-on stuff, right? So I think like sufficient working experience is required in order for me to be able to decide which specialty I want to pursue.
Nurin, how much does a fresh graduate dentist get paid on average?
After you serve your compulsory service, I think most private practice would offer a basic salary of maybe 5K to fresh dental graduates. However, most dentists actually, if you work in the private sector, most dentists actually get paid based on commission as well. Some private clinics actually offer the salary of basic plus commission. Sometimes some clinics offer commission only, or basic only, depending on whichever is higher. So yeah, that's about it lah.
What are your future career plans?
Not in the near future, like in the maybe one day, inshallah, I have the dreams to specialize, get that specialist title, or open up my own practice lah, inshallah. We'll see how it goes from here when I start working later on.
Nurin, can you please describe your journey Lepas Sekolah in 3 words?
Meaningful, long, I guess fun. My name is Nurin Kamilia, and this is my journey Lepas Sekolah.